But this piece, the shot on this one is the bullet went through right about here. And so this piece is all kind of blowed up, okay? Now I'm going to be able to fix that, and if I have to take a piece from your leg and put it in there, I will go ahead and do that, okay? Now, the reason that you're numb, okay, is when this happened, is one of the nerves that comes across here, called the posterior interosseous nerve, comes right across this area, okay? And I know it's there, all right? And it's what I call a feisty nerve, okay? There's some, if I have to move the ulnar nerve, which is where when you hit your funny bone, and you know how that feels, and you get that little one makes your fingers numb for a little while, that nerve, if I have to move it all over the place, it does well, okay? This is a branch of the radial nerve, and the PIN's in here, and that's why everyone gets freaked out about working here. All right, you have the numbness because the PIN was injured, okay? It was injured by blast effect, not necessarily transected, meaning it wasn't cut. So we anticipate that over the course of time, this sensory deficit that you have and some of this motor deficit you have should return, okay? I'll tell you because I'm gonna look at it today. But very rarely, and I've done thousands of ballistic injuries over the years, is when these things come, it pushes stuff out of the way, but the nerves don't like it and they get stretched out a little bit, and that's why they sometimes get angry. And I'll give you some special medicine to help that out and minimize you having problems with it, okay? May or may not have a permanent numb spot here, okay? I can't tell you for sure, all right? May have some weakness in the arm, can't tell you for sure, okay? But I will go ahead when we make this incision, I'll try to protect this. A lot of the muscle has been injured in there, okay? And I'll protect it throughout there, and that's why we'll go ahead and take a look to make sure we get that, okay? Now, blood loss on this, not much. You're not going to need transfusion, okay? Risk of infection, I'm putting a bunch of plates and screws in there, about 1 in 100 or less, okay? Yeah, there's some dead muscle in here, but being a young, healthy woman who's not diabetic and the holes are small, should have minimal risk of that, okay? Now, two things that can happen. If I have to take the bone down here, I'm doing it because I want this to heal, okay? If this doesn't heal, sometimes I have to come back and put bone graft into it, okay? And if that were to occur, then we would just have to do another operation. I have to open things up a little bit and put some bone graft in because this piece is kind of powdered right now, okay? But once again, eat right, take your calcium, eat some cheese and yogurt. Hopefully that will heal up fine, okay? A lot of times that's for the older folks, and I've done in my age population, I'm primarily young and adolescent, and I do very well with these. Okay. Now you are set up, and I'm going to do my best to help you out with this one for something that can occur, which is when you see this, you're able to do this because you have two bones in your arm. Okay, these proximal ones up here sometimes will get what's called a synostosis, where it tries to heal as one bone, which is why I'm doing 2 incisions and I'm being very careful. But because the muscle has been injured in here, that bone tries to heal together. Okay, if it does, I'm going to try to keep you in a good spot where you're in for keyboard, and so you can do other things with it. Your elbow joint will work, but this is the one thing I want to try to make sure I maintain. But I want you guys to understand that if the bones got stuck together, it ain't me, okay? And having done this, but we will start some therapy as soon as we can, okay? This should not mess with you going to CSU. You'll just do it in the what'll be the 5th? I'll try to have you out of that cast in 4 weeks, maybe get you in a functional brace so we can get that and get her therapy going, okay? Now I want to make sure she's going to get a nice cast today just to hold everything in place, but it'll be like this. This is just a little bit more of a challenging injury, okay? And I've done them, but I want to let you know just those are the things that can be speed bumps along the way.
Right.
Okay, we can work on these things, all right? But, you know, compared. Now, you didn't get it in the flank too, did you?
Yes.
Yeah, but let me tell you how lucky you are with that one, okay? No, that one's sitting out in front of the inferior vena cava, so that was, I looked at that stuff the other day, so you did, you know, lucky. Okay, that one you're very lucky on. So I'm glad that we're able to take care of this. If it's one non-dominant arm, okay, I will do my best to take care of it and get you the best function back, okay? And that's what I can do, is I can try to get the best. I've done a few of these. Luckily, she didn't blow the joint up, okay? So we should be able to, you'll definitely have this, okay? And we'll work on that pretty quick. This is the one thing we're going to work on getting back. But if not, I'm going to make sure, even if it got stuck, you'll be in a position, you'll do this, and you'll be able to use the keypad, because that's the most important thing.
Right.
So, all right? All right. We'll get you a nice cast today at the end of the case. Blue, red, purple, pink, or white.
Pink.
You got it, man. We can do that for you. And I'll get you guys a card. I'm just going to make sure that I've got that consent all set up there. We should